She got the Glaucoma Award in the first midterm conference in Patna on factors affecting compliance to anti-glaucoma medication during COVID-19 and its effect on progression. Dr. Rupa.
Thank you, ma'am. Good morning, everyone. So I'm going to present the topic on factors affecting compliance to anti-glaucoma medications during COVID-19 and its effect on progression. I have no financial disclosure and non-conflict of interest. So as we all know, COVID-19 pandemic since 2020 has put a huge impact on the general life and healthcare system, due to which multiple recurrent lockdown has been implemented in various parts of the country in multiple phases. For example, in first phase it was from March of 2020, and in second wave it was from March of 2021, in order to curb down the unprecedented spread of the virus and the resultant fatality. Travel restrictions and mass quarantine were implemented throughout the country, which hugely affected the treatment of chronic diseases like glaucoma. As we all know that even before the pandemic also, the adherence to anti-glaucoma medications and failure of periodic follow-up visits was an issue, and the pandemic had led to worsening of the situation. Now this study aimed at finding the factors that affect the compliance of anti-glaucoma medication, especially during the second wave of COVID-19 pandemic and the progression of the disease due to it. It was an observational cross-sectional study in the tertiary care hospital in the Cuttack district of Odisha from December 2021 to June of 2022. The inclusion criteria was we took patients of primary open-angle glaucoma who are on anti-glaucoma drugs and 18 years and older, and we excluded newly diagnosed cases of glaucoma, secondary glaucoma, primary angle closure glaucoma, history of glaucoma surgery, patients who were non-compliant before second wave of the COVID. So the methodology we used was the study was conducted in two parts. The first part consists of a questionnaire which included the demographic and clinical data of the patients, barriers for medication adherence during the pandemic, and the second part consists of examination like best corrected visual acuity using Snellen's chart, intraocular pressure reading using Goldman applanation tonometry, and visual fields by automated perimetry, and retinal nerve fiber layer thickness by OCT. The observation and results: the total number of patients we examined were 220 eyes of 220 patients, and the patients found to be non-compliant to anti-glaucoma medications were found to be 59.09%. Now coming to demographic details, most of the patients in our study were from the rural population, that is 58.18%, and more than 50 kilometers they have to travel to the hospital, 63.18%, and 67.72% belong to the lowest socioeconomic status, and 77.72% of patients were on more than 2 anti-glaucoma medications. Now, the following were the barriers for compliance to medications during the COVID-19 pandemic. The 29.23% were due to financial difficulties, and followed by 24.61% longer distance to the hospital, 20.78% unavailability of the transport, and remaining were non-availability of the medications, caretaker non-availability affected by COVID-19, and family member illness. So now we actually compared the pre-second wave COVID-19 and the post-second COVID-19 variables using the paired sample t-test like best corrected visual acuity, intraocular pressure, RNFL thickness, and visual field index. And all were found to be statistically significant with a p-value of less than 0.001, as we can see in the screen. Now coming to discussion, in our study, 59.09% patients were found to be non-compliant to anti-glaucoma medications, whereas the study conducted by Subhadra G and et al. Showed a non-compliance of 57.3%, and Akan et al. With a non-compliance of 28.4%, whereas the study which showed the highest non-compliance rate was by Rizwan et al., which is 80.5%. Now, the main reason for non-compliance to medication in our study was financial difficulties, that is 29.23%. But the studies conducted by Subhadra G et al., Somi et al., and Rizwan et al., they showed non-availability of the medications as the main barrier. In our study, 80.76% had raised IOP, 24.61% has decreased RNFL thickness, and 12.30% had reduced VFI than pre-COVID times as an effect of non-compliance, whereas the study by Somi et al. Showed 81.25% with raised IOP and 78.13% with reduced VFI. So concluding the study, as we all know that COVID-19 pandemic had caused a statistically significant increase in the rate of non-compliance to glaucoma medication, principally due to lack of financial resources in our study, and this non-compliances has resulted in a statistically significant increase in intraocular pressure and decrease in best corrected visual acuity, retinal nerve fiber layer thickness and visual field index compared with the pre-pandemic situation among patients presenting to our tertiary care facility. So we recommend that teleophthalmology should be the future to meet the need of the glaucoma patient, especially during pandemics. Thank you. This is the questionnaire, and thank you.
I know you're not part of the competitor section, but there are certain questions that arise from your presentation, excellent presentation, which, because we have time, we can talk about it. How do you think teleophthalmology helps in glaucoma?
Ma'am, in conditions when there is some epidemics or pandemics, when the people cannot visit the hospital, we can use teleophthalmology as a...
How do you do applanation, gonioscopy?
Yeah, ma'am, that.
So the only thing you can do is probably counsel patients that you have to continue with your medication.
The ongoing medication.
But the difficulty in glaucoma herein is that it is a progressive disease. So even if they don't discontinue, there is a likelihood that they can progress. There is a risk. So teleophthalmology, in my opinion, I refuse to do teleophthalmology. I'd rather just tell the patients continue with your medication than waste, You can't do applanation, you can't do gonioscopy, you cannot see the fundus, you can't see the disc. Anyone has any questions, any comments? We have time because I'm still alone. So, the other point that I thought is useful is that you said open angle glaucoma, you said primary open angle glaucoma, but you have a few patients below the age of 40. So they are actually juvenile open angle glaucoma.
No, ma'am, I excluded everyone from below the age of 40, ma'am.
No, you said 18.
Yes, ma'am. From 18
But
onwards,
you showed, there is a graph which shows a few patients.
Yes, ma'am.
So they are juvenile open angle.
Yes,
Believe me, juvenile open angle glaucomas will progress much more than primary open angle glaucomas.
Yes, ma'am.
Yeah. No one has any comments? Any views to share? You're all open.